Welcome back. As the globe nears nearly 40 million of confirmed COVID-19 cases with more than 3,000 deaths recorded today alone, the World Health Organization says services for mentally ill and substance abuse patients have been disrupted worldwide during the COVID-19 pandemic. It expects the disease to cause a further distress for many. In fact, some are warning that the second wave may be the mental one. Only 7% of the 130 countries responding to the survey reported that all mental health services were fully open, with 93% reporting curtailed services for various disorders. Only 17% of countries have ensured additional funding to implement activities supporting mental health during the pandemic. According to the survey, many countries, especially low-income ones, maintained mental health services at hospitals, but many patients face other challenges. Outpatient and community-based services, often in middle and high-income countries, were more affected. To talk more about this, we are joined via Zoom by Dr Ashika Pillay, a medical doctor and wellbeing practitioner working towards a better understanding and promotion of overall wellbeing. So a very warm welcome to you, and thank you so much for speaking to us. This being Mental Wellness Month, talk to us about the piece that you recently wrote. You said mental health is not just mental. So just expand a little on this for us, please.
Sure. Thank you so much for having me. And I think you've given a great context to where we're sitting presently in the middle of a pandemic, and definitely the concern around this mental health pandemic that's really looming, and many of our citizens across South Africa and the globe actually in the middle of it. And really the reason I wrote that piece is because mental health isn't just mental. Our bodies and our minds are intimately connected, and we need to take care of our minds to take care of our bodies, and at the same time take care of our bodies to take care of our minds. And if we look at a fragmented view of health and well-being, we may not be achieving the outcomes that we want to. And we may also fall short in terms of looking at comprehensive and holistic well-being.
And I'd imagine one of the reasons, or some of the reasons, why COVID-19 has been unprecedented with regards to mental health has been the fact that I don't think any of us could have ever conceived being isolated, restricted movement in such a way that you couldn't even use that, exercise as an outlet, or socializing with people in order to cope with the myriad challenges we had to face.
Absolutely. I think the whole change in routines, in structure, in the ability to do what we normally did was a massive learning and an adjustment and adaptation. And it really called on a lot of capacity to build our own resilience in facing the lockdowns, and in South Africa not being able to move around for quite a few weeks. That really placed a lot of challenge on people, together with all the uncertainty that exists in the context of our economy, of work-life balance, of children schooling, and so many other uncertainties that have surfaced since the start of the pandemic.
I want to talk about why you believe that we may not really understand what sustainable mental health is. What are the trends that you're seeing?
I think the one thing that the pandemic has certainly highlighted for us is that if you look at the context of the most vulnerable that get the worst outcomes in terms of the infection itself, you can see that there are people with chronic lifestyle diseases. So high blood pressure, diabetes, obesity are really the key ones that have had the biggest impact on morbidity and mortality in terms of COVID-19. And my belief is that we were already in many pandemics before this infectious disease pandemic. The pandemic across the globe in terms of diabetes, high blood pressure, cardiovascular disease, something that we call in medical terms the metabolic syndrome, and obesity and overweight are the key things that are most important for us to look at in terms of our sustainability and the capacity of us as human beings to become better by being better, being well, so that we can be well both in mind, in body, and in spirit.
And now to talk a little further about the local context in terms of mental health here. You've mentioned some of the differentiations from, community to community, maybe country to country. But I also want to talk about it from the prism of, it would seem that a lot of people would be unsympathetic to the kind of stresses that people went through simply because they weren't experiencing that. So how do you know that you're stressed and deal with it in a manner that is manageable? And people actually do understand from where you're coming from, because you also don't want to be regarded as redundant, etc., etc.
A very important question about how do we know whether we're stressed or not. And really here are practices that we need to fit into our lives about how much do we know our bodies? Do we tune into how stress feels for us? Perhaps it's an elevated heart rate. Perhaps it's sweaty palms. Perhaps it's a feeling of anxiety sitting in your chest. Perhaps it's a change in your mental and emotional status where you're not able to communicate and contact people and respond to relationships the way you did in the past. So really, it's been the time to look at ourselves from a reflective perspective. How well and how much do we know ourselves? Can we tune into what stress feels like for us? And can we use other technologies that may be able to help us in terms of understanding our bodies better?
And part of that, you have also said we are what we eat, but how do we encompass the physical and emotional elements in mental health treatments? Because often you're too debilitated to actually want to get up and do something, and you don't have the wherewithal to talk yourself into a good emotional place.
I think it's very important when you're dealing with mental health to understand what you need in the moment. We're talking about more sustainable well-being that is going to help you over the long term. But certainly over the short term, what is important is to understand where you need support and to reach out for that support, to be able to contact people in your social circles, or to perhaps reach out to organizations like SADC, the South African Depression and Anxiety Group, as an example, who have really provided incredible support for our South African population over the last 6 months, especially during the pandemic, and to know what it is you need and how you can respond appropriately to what you need in the moment.
Thank you so much for speaking to us, Dr. Ashika Pillay, a medical doctor and well-being practitioner, speaking to us about what you can do during this mental wellness month. Coming up, we speak to Terry Oakley-Smith at 7 p.m. She's founder and MD of Diversity on Racial Tensions following the Senegal